Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm doing another Kahoot, but I'm going to be covering NCLEX topics, and I have lots of topics to cover, so expect lots of Kahoots coming your way. But anyway, this is going to be the first part of my NCLEX topic series on Kahoot. It doesn't go in any order. I'm covering all systems in this Kahoot, but I think this Kahoot's only 15 questions. But anyway, this is a great video for you to watch and make sure you understand these concepts. And if you don't, go back in your textbook and read about them, because each concept that I'm covering, they've been seen on NCLEX, okay? So before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. Press that thumbs up button. Go ahead and subscribe to my channel if you haven't done so already, and press the notification bell so you'll be notified every time a new video is released. Don't forget, I'm now offering NGN NCLEX reviews. You can book on my website, and you can also order an audio lesson on my website, nexusnursinginstitute.com. All right, guys, let's get started. NCLEX concepts, important concepts you need to know. Make sure you study if you don't know it. You're making rounds on the unit. Which patient complaint should be prioritized? A patient diagnosed with hepatitis and they state their arms and legs are itchy. The patient diagnosed with osteomyelitis saying they're nauseous and can't eat. The patient diagnosed with arthritis saying I can't sleep at night. Or the patient diagnosed with a femoral fracture, they're in a cast and they say this leg feels tingly. Which patient has to be prioritized? Which patient would you see first? There are a couple people who haven't answered yet. I need everyone to answer. What do you think? Okay, it's that patient with the diagnosis of a femoral fracture. They are in a cast and they say that their leg feels tingly. This is very important for you to understand. A patient that has a fracture, a patient that is in a cast, something that is causing restriction to the area. If that patient says, I feel pain in that area, or I feel numbness in that area, or I feel pins and needles in that area, or it feels tingly in that area, you better go assess that patient, because what you're suspecting is compartment syndrome, right? And if you miss that, you may cause that patient to lose that extremity. So that's very important. That's the patient that you're going to see first. That is the patient that you're going to prioritize. Next question. Your patient has returned to your floor following abdominal surgery. After checking their vital signs, what should be your next nursing intervention? They just came back from surgery. Are you going to position the patient on the left side, supported with pillows? Are you going to check the chart for the most recent INOs? Are you going to assess the abdominal dressing for symptoms of bleeding? Or are you going to check the pulmonary status for the presence of infection? Your patient just came back from abdominal surgery. You already checked the vital signs. What is your next nursing action? Okay, very good. You can assess the abdominal dressing for symptoms of bleeding. So I want you to think about it. Your patient just came from the surgery room. Okay, they came from the operating room. I don't care what type of surgery the patient has. I don't care if it's abdominal surgery. I don't care if it's, an amputation. It doesn't matter. If your patient comes from surgery, you're going to be concerned about three things always. Your top concerns are always going to be bleeding. Them hemorrhaging, they just had an invasive procedure. You're also going to be concerned about them possibly developing a clot, that clot moving and going to their lungs. And eventually, you're going to be concerned about infection. And the reason I said eventually, if your patient just came to you from surgery, it's too soon for them to have an infection. But after they come from surgery, after, you know, a couple of days, they may develop an infection. So you do need to be watching out for that, just not immediately following surgery. So the fact that I told you they just came from your floor, what are you going to do next? You better be looking at that dressing and make sure that they didn't bleed out, because remember, hemorrhage is going to be one of your primary concerns. Now let's look at the other choices. Putting them on the left side and supporting it with a pillow. Absolutely, that is a nursing intervention that you want to do, but that's not going to come before assessing your patient. You want to assess them and check that site for bleeding. Checking the most recent INOs. Great, but that's not priority. And look at checking the pulmonary status for the presence of infection. Well, when you did your vital signs, you also checked the pulmonary status when you looked at the respirations and you listened to the lungs, right? But you weren't doing that to check for infection because it's too soon. That patient just came for you. We're not thinking that they're going to be developing infection, but you're going to do that because it's part of your assessment. So your priority after your vitals is to check for bleeding. After a radical mastectomy of the right breast, how should you position your patient? Should you place them on the left side with their right arm supported in a sling? Should you place them on the right side with the right arm elevated? Should you place them on semi-Fowler's position with the right arm elevated? Or should you place them prone with the right arm elevated? What do you guys think? How are you going to place your patient who just had a right-sided mastectomy? Very good. You're going to place them semi-Fowlers with the right arm elevated. So let's talk about this. They just had surgery. After surgery, we're always concerned about hemorrhage. We're concerned about DVT or PE, and we're also concerned about infection. A type of infection could be possibly pneumonia, right? We're going to have them sitting up. Sitting up is the best position because it helps the lungs, allows the lungs to expand because the lungs are compressed. It allows the diaphragm to go down as the lungs expand. It helps drainage, right? And it helps to decrease edema, and you're not putting pressure on that surgical site. So this is the best position to put the patient semi-Fowlers with the side where they had the surgery, that arm elevated to promote drainage and decrease swelling. When you walk into your patient's room, he says, "Ooh, baby, you're so hot." Which response is most appropriate? Do you say, "I feel uncomfortable when you make those remarks. Please stop." Or do you say, "I don't think either of our spouses would find that remark appropriate"? Or do you say, "Like I would ever give you a chance"? Or do you say, "You're such a flirt"? How do you respond to the patient that says, "Ooh, baby, you're so hot"? Okay, most of you guys chose the correct answer. Very good. You tell them that they make you uncomfortable and to please stop. You don't tell them like, "I would never give you a chance." So here's the thing. Look at the wording. Look how it's worded. "I feel uncomfortable." So you're putting that burden kind of on you. So you're not being confrontational about it, but you're still letting them know that it's inappropriate. They're making you uncomfortable and you're asking politely that they stop. Therapeutic communication. Your patient is about to get an MRI of the head, neck, and chest. Which observation requires immediate attention? If the patient removes their dentures, if the vital signs show blood pressure 120/60, respirations 18, and pulse 82, if he's wearing red nail polish, or if he's wearing a nitroglycerin patch, which one requires immediate attention for the MRI? I need everyone to answer. There's some people who haven't answered yet. Let's go. Okay, very good. He's wearing a nitroglycerin patch. That patch needs to be removed. Whenever you guys get a question when they say what requires further intervention or immediate attention or follow-up or clarification, what they're really asking you is which one is the wrong thing to do, which one is the wrong answer choice. Removing dentures, that's good. Those vital signs, that's good. Him wearing nail polish, there's nothing wrong with that. It's not like we're taking a pulse ox. The patient's getting an MRI. So the problem is that nitroglycerin patch that needs to be removed. Which statement is best to give a post-hip replacement patient that's ordered to begin ambulation using a walker? Do you tell them to always tie their own shoes before ambulating? Do you tell them they can start weight bearing on the affected hip soon? Do you tell them to make sure that the rubber caps are secure in all four legs before they start to ambulate? Or do you tell them to be sure to sit in a low chair for comfort after ambulation? Okay, make sure that all four caps are on the rubber caps are on the walker before ambulation. This is a safety issue. Remember, this patient just had a hip replacement, so this is going to be wrong. They are not going to be bending over to tying their shoe because they are not going to be flexing that area, that 90-degree angle. Absolutely not. And they cannot start weight bearing on the affected hip. They're not good. Listen, they're not going to be doing weight bearing for at least at a minimum 6 weeks. So that's wrong. And look at this, sitting in low chair. Again, we don't want that flexion of the hip. So all of those are wrong. So we're going to teach them to make sure the caps are secure before they start ambulating. Again, that's a safety issue. A pregnant woman at term presents to your ER in early labor. She's found to have a diagnosis of placenta previa. What is going to be your priority action? Are you going to start IV terbutaline, breathing, and monitor the vital signs? Are you going to prepare for immediate C-section? Are you going to maintain the patient on bed rest until she has a spontaneous delivery? Or are you going to monitor the contractions? What is going to be your priority action for this type of patient? There's 12 more people in the room. I need you guys to answer. Make a decision. Prepare for immediate C-section. Very good. And let me show you what the key was to let us know what our answer was. Look at this. She's at term. This is not a preemie. This is not going to be a premature infant. She's at term. She's at term and she's in early labor.
So we are not going to give terbutaline. Terbutaline is something that we would have given to delay labor, you know, if this was a previa that we would have been dealing with, but she's at term, so that's not the case. We're not going to maintain her on bed rest until she's gone into spontaneous delivery. Are you kidding me? She has placenta previa. She's going to get a C-section. And we're not going to monitor contractions again. She has placenta previa. She's at term. She's going to get that C-section. Which observation would indicate an early complication of hypoxemia in your patient that has epiglottitis? Is it tachycardia? Is it cyanosis? Is it circummoral cyanosis or dysphagia? Now, while you're thinking of your answer, let's talk about epiglottitis. Remember, the epiglottis, that is that, what's the word I'm looking for? It's going to come to me, but it's that flap at the base of your tongue, right? And it closes whenever you eat, it closes, it depresses so that the food doesn't go in your windpipe and it goes down your esophagus and through your stomach instead. So that's what we're talking about, that flap at the base of your tongue that keeps food from going into your windpipe. Imagine that's inflamed. Patient's got hypoxemia. What is the first sign of a complication that you would see in that type of patient? Tachycardia. So guys, let's talk about this because most of you guys chose dysphagia, but guess what? Dysphagia, that difficulty swallowing, that is a symptom of epiglottitis. But look at what the question's asking us for. It's asking us for an early complication, not a symptom. Dysphagia is a symptom of epiglottitis. We're looking for a complication. A complication is something wrong that happens when something else wrong happens. So for example, something wrong is our epiglottitis, but what a complication, what bad can happen out of that patient having epiglottitis? What is the first symptom of seeing the patient is in a hypoxemic state? And guys, the correct answer, and it's not cyanosis. Cyanosis is a late sign. Cyanosis is bluish coloration of the skin, and that's a late sign of hypoxemia. Circummoral cyanosis, that's the bluish color around the lips. That is a late sign of hypoxemia. But tachycardia, seeing that heart rate goes up, that is an early sign of hypoxemia because what's happening, that heart rate increases because it's trying to push out more oxygenated blood to go to the tissues because the body recognizes it's in a state of hypoxemia and is trying to increase perfusion. Your patient has a cast and suddenly complains that it's hot and painful under the cast. What would be your priority nursing action? Are you going to assess the cast for wetness and air circulation? Are you going to check the circulation of the affected extremity? Are you going to take the vital signs and monitor the patient for hypoxemia? Or are you going to medicate the patient as ordered? They've got a cast and they're complaining that it's hot and painful under the cast. What is your priority nursing diagnosis? What's your priority nursing action? There's 10 more. Come on, guys, go ahead and answer for me. Okay, you're going to check the circulation of the affected extremity. So you're going to check that extremity that the patient has a cast, right? You're going to be touching the area and see if it's warm. That warmth lets you know there's circulation. You don't want it to be cold, so you're going to check for circulation. You're going to check to see if it's painful. You're going to check to see if it's tingly. You're going to check to see if they have paralysis in that area. You're going to check your 6 Ps because we're concerned about compartment syndrome. The patient's exhibiting signs and symptoms of dehydration. Which IV fluids are you going to expect to be ordered? They have dehydration. Do you expect D5W, half normal saline, or lactate ringers? Which IV fluid do you expect to be ordered for dehydration? Okay, you're going to give your patient half normal saline. So for dehydration, that is a good choice of IV fluids. And I want to talk to you about the tonicity. So half normal saline, that is a hypotonic solution. There's more fluid than solutes compared to the body, right? So what happens is with that hypotonic solution, that's going to pull more fluids within that vascular space, and that's where we need the fluid. So that's something we're going to give to the patient. Now let's talk about the other choices. D5W, that's a hypertonic solution, right? That's contraindicated in a patient with dehydration. We're not trying to get fluid out of the vascular space. We're trying to get fluid in the vascular space. Now look at normal saline and lactate ringers. Both of those are isotonic solutions. And isotonic solutions, those solutions are closest to, your blood, what's the word I'm looking for? The consistency, I should say. So when it comes to the isotonic solutions, such as your normal saline and lactate ringers, you'd give that to something like a burn patient. But when it comes to dehydration, you want to give something like half normal saline, hypotonic solution. Which teaching would be best for a 10-year-old that has been scheduled for a cardiac catheterization? They're 10 years old and they have to get a cardiac cath. What teaching would be best? Showing them a video explaining the procedure, providing them with a pamphlet explaining the procedure, drawing a picture of the heart explaining the procedure, or presenting a puppet show explaining the procedure. Which would be most appropriate? Okay, the correct answer is drawing a picture explaining the heart. So at 10 years old, this is a school age child, so they understand a lot. So drawing a picture and explaining the procedure, and you're allowing them a chance to look at the picture and ask questions, him or her, and ask questions. That is perfect. I saw a lot of you guys chose 15. Showing a video would be good for an adult patient, or even an a young adult or older adolescent, but not a school age, not a 10-year-old. The puppet show would be good for someone younger, such as a preschooler or even a toddler, but not a school age child. Your patient presents to the ER with a perforated bowel. What intervention is going to be priority? Is it going to be to maintain the patient in semi-Fowler's position? Is it to prepare for emergency surgery? Is it to notify the next of kin because they're a goner, or maintain the patient in the prone position? They present to the ER with a perforated bowel. What is going to be your priority? Very good. Prepare for emergency surgery. There's nothing else you can do. They're going to have surgery or they're going to die. And it's not a question of if, it is when. I want you to think about it. They have a perforated bowel. So now you have stool, you have feces in what's supposed to be a sterile environment. They will die. They have to get surgery. So you're going to prepare that patient for emergency surgery. You're scheduled to give the next dose of hydralazine to a patient that has a blood pressure of 90/60. what's going to be your nursing action next? Are you going to withhold the medication? Are you going to check the urinary output? Are you going to administer the medication? Or are you going to increase the magnesium dosage? Okay, guys, so the correct answer, you're going to withhold that medication. We know that hydralazine is given to lower the blood pressure. By the way, guys, when it comes to antihypertensives, hydralazine isn't the first choice. We give hydralazine when, the other medications hasn't worked, right? Hydralazine is very strong. So this patient is about to get hydralazine, which is very strong. It's expected to definitely lower that blood pressure by a lot. And their blood pressure is 90/60. We're going to throw them into a hypotensive crisis. So you're going to withhold that medication and call the healthcare provider. 2 more questions to go. Your patient scheduled for a skin biopsy. What statement requires immediate follow-up? If the patient says, I've been taking aspirin for my back pain, or if the patient says, I've been using lotion and it's been helping me with my dry skin, or if the patient says, I just came from the tanning booth yesterday, or if they say, I skipped breakfast this morning, which requires immediate follow-up? Them taking aspirin. A skin biopsy, as small as that is, right, it's still invasive. It's still puncturing the body, right? And what does aspirin do? It causes bleeding. So we're going to be concerned about that. That's going to require further follow-up. All the other choices is not going to alter the test at all, but that aspirin may possibly alter that test. So that's the one that requires follow-up. And we are down to our last question. Which assessment would be a priority to report in your patient with hyperparathyroidism? Would it be abdominal pain, hematuria, muscle weakness, or diaphoresis? Hematuria. Let's talk about this, guys. Whenever you're thinking about the thyroid, you're going to think about metabolism, right? But when you're thinking about the parathyroid, you're going to be thinking about calcium in the blood. If the patient has hyperparathyroidism, they're going to have a lot of calcium in the blood. All that calcium in the blood can cause what? Calcium stones. So we're concerned about that patient having stones in their bladder, right? Calcium stones. So hematuria. Are we ever supposed to see blood in the urine? Not at all. So the calcium stones, we may see that calcium in the bladder. The patient can have kidney stones still made of calcium, which is very painful, by the way. But anyhow, we would still see hematuria, which would let us know there's a problem. So the fact that you saw hyperparathyroidism, your brain should have went to increased calcium. You should have thought about all that calcium traveling in the blood, getting to the kidneys, causing kidney stones. Now patients got a UTI, or, you know, they may even be releasing calcium through the urine. So the correct answer is hematuria, which is a sign of cystitis or bladder infection. Let's see.
Okay, guys, I hope you enjoyed that video, and I promise I have many more coming. And go ahead, I'm getting a lot of messages about different topics that you want me to cover. I have a running list going, just like I have a running list going on my videos that are published every Sunday, 1 p.m. Eastern Standard Time. So if there's something you'd like to see me do a Kahoot or maybe just a video, go ahead and let me know in the comment section. Please don't forget, I have NGN and NCLEX reviews that I'm currently booking for, and you can also get an audio lesson. All of that can be found on my website, nexusnursinginstitute.com. Thank you so much for watching. You guys will catch me on the next video.